Hello guys, welcome to our presentation. Today we are going to present the Dunwoody Medical Center that we have created because your health is our concern. And the group members are Mia Palmer, Scarlett Webb, Sarah Gaunt, myself, David Torres, Joelle Mansour, and Lauren Ham. Here's our site. Dunwoody is a home for families with many multiple family housing and condos that are thriving with commercial areas. It is very family oriented with thriving green spaces. It was previously a commercial property, which was converted to a multidisciplinary practice. And the site is on Ashford Lane, Suite 402. It is highly retail space, which is now turned into a healthcare facility, and it is a mixed-use doctor's offices. The design really focuses on COVID-19 precautions. It's very modular and easy to repeat. Its clientele is driven by design and convenient and accessible to the families that are around the area.
So our design stemmed off one simple mantra: health flows from within. Comparing the human body with that of a tree, we've used natural and organic forms in our design as well as natural elements to access the restorative properties of nature. Influenced by nature, our design is intended to bring a sense of calm to the patients and staff. We intended to reflect the regenerative and restorative nature of biophilic design, coupled with the most modern technologies to create a efficient and fantastic patient experience. Likening the body's arteries and veins to the life-giving roots of trees and plants, our design reflects this organic flowing aesthetic. We are pairing this biophilic design with high-tech modern technologies to help further our design for functionality, efficiency, and flexibility. Next. Within our design, we've incorporated a lot of technology. The biophilic part of the design relates to the human body and is juxtaposed to the technological innovations we use to deliver medicine and treatment to ailing patients. The combination of both biophilia and technology signifies a meeting of both body and modern innovation. You'll see this from the moment that you get to our practice. We have telepods in the outside waiting area that use interactive smart glass mirrors. We have pneumatic air tube dispensaries to limit contact for medicine delivery. And we also have interactive reception OLED screens as well. Next.
So as for materials, we have chosen an array that are easy to clean and to maintain for infection control given the ongoing pandemic. We have also used colors for wayfinding to create a vibrant atmosphere that is uplifting to patients' moods, flooring that is cleanable, resilient, and replaceable, smart glass that is used to create a sense of transparency between patient and doctor while being able to maintain privacy and cleanliness. And it's driven by research. The colors emulate the palette of nature to aid in recovery and ease any anxiety the patients may experience.
As for our overall floor plan, we've created a U-shaped plan with centrally located nurses' stations that provide efficient access for the staff and patients. The circulation of the patient is generally one directional, starting from the inside of the reception area, following the centralized pneumatic air tubes, back to the exam rooms, and then to the pharmacy, and rounding back to the exterior hall to checkout. There are centralized nurses' stations that are easily accessed by all exam rooms and doctors' offices. At the very beginning in the reception area, we separate the well and unwell patients in separated waiting areas. Some more focuses of our floor plan include multiple private exam rooms. We've got double-sided nurses' stations with a central office in the middle. We have ADA compliant exam rooms as well as doctor checkup pods and restrooms, a central lab and imaging center, specialty procedure rooms, and we've consolidated a lot of different services within the same building. Here, the floor plan is color coded in a light green to really accentuate the areas of circulation paths of patient and employees. Patients do have access to the majority of the building, and the staff have access to clearly marked sections in the very back for their area.
So moving on to our reception area and some perspectives of our design. As we've mentioned, we are planning on separating sick and well waiting into two separate areas, and the furniture plan we've chosen promotes distance and allows patients to face away from each other to avoid breathing contaminated air. This reception area is also located directly next to and is attached to an outdoor waiting area that is also available for patients to wait in and allows for ample social distance. Our interior terrarium really anchors the reception desk and provides a secondary source of daylight. So for our exam rooms, our typical exam room, when available, will have smart glass that will be off and clear. If it is in use, the color of the smart glass will become opaque and color coded to the stage of the exam that the patient is in. We also have a curved wall that provides privacy to the patient while the doctor enters and exits, while doubling as a mirror screen for doctors to use when addressing patients and sharing information with nurses. The cabinetry follows the design of a galley in a plane, where rolling cabinets can lock into place and be pulled away from the framework when needed. This will aid in cleaning the room for patient turnaround, as these cabinets can be changed out, and also adds to the flexibility of our design. We're including a UV light to sterilize surfaces between patients, and smart glass will indicate when the UV light is in use. Reclining exam chair that we've chosen gravitates away from anxiety-ridden traditional exam tables and provides more comfort.
Here we have a view of our pneumatic air tubes that we have centered through our building. They kind of have this whimsical feel to them that goes through the center of our building and out to our patient pods and drive-through pharmacy. They're used to transfer medicine that the pharmacist will man.
So we chose to include a pharmacy in our medical center just to make it easier for patients to not have to leave the medical center and then go to a drugstore to get medications. So after leaving the exam room, the patients can walk directly back to the pharmacy to receive those prescriptions. And we've also included adjacent to the pharmacy a small drugstore, which is stocked with bandages and any other over-the-counter needs you may have, so as to not have to go to another location to get those items. You can sit in your exam room and wait for medications to be ready. We also have this wonderful waiting room outside of the pharmacy area to wait in, but we've also created an app that'll tell you when your prescriptions are ready and show you which pod you can go into. And those pods are where you can meet virtually with a pharmacist in private to ask any questions regarding medication. And then the pharmacist will deliver those prescriptions through those pneumatic tubes and into the pods. And also, they would do the same through the drive-through pharmacy via this area, where a pharmacist will man those pneumatic tubes and send the prescriptions to the drive-through pharmacy using an intercom to relay prescription information.
So to relieve some anxiety about going to the doctor's office, we've introduced a green parking lot and a patient pod experience. For some people, coming into the doctor's office is more of a barrier than it is a good thing. So we've created these pods that when you go on your app, you request a pod and you know what time it is, and you go into this pod and you use the mirror screen to have a video conference with a doctor. From there, they can assess if you need to come in, or they can send you medication through the pneumatic tubes. Here you have a perspective of our outdoor waiting area, which leaves ample room for social distancing and allows patients to get some more biophilic love in there as they wait for their exam room.
So thank you for joining us today. We hope that you really enjoyed the Dunwoody Medical Center. As you know, we have gone through a lot this year with COVID, and we just really wanted this project to focus on healthcare and the good of the people. And so healthcare innovations lead to new designs. Thank you for joining us.